Hi, everybody, and thank you for joining the live CCIH virtual conference. Our discussion today is on leadership, care for staff, and self in the COVID era. We're going to give it just a few more minutes for people to join. So I'll say this again in a moment, and we'll give it just a few more minutes. If you're just tuning in, we're going to get started in a few minutes. This is the CCIH virtual conference. Our discussion today is on leadership, care for staff and self in the COVID era. We're going to give it just a few more minutes for people to join in. It's always that awkward time when you're waiting to get started and people are sitting there staring at the presenters. So I was tempted on a recent call to get people to start singing and decided not to do that. I'm not going to do that with our presenters here either. So. So we'll give it just one more minute. If you've just joined in, this is the CCIH virtual conference. Our discussion today is on leadership, care for staff and self in the COVID era. We'll wait just for one more minute. Well, okay, I think we can go ahead and get started now. Once again, thank you for joining the CCIH virtual conference. This is the first time that we've held the entire conference online. So for those of you who are used to coming to our in-person events, what we will lose in our personal contact, we will more than make up for with many more people able to participate around the world. In fact, we know that there are at least 52 people in 52 countries who are joining in with us. We're very excited about that. Please do still let your colleagues know about this and take a look at our upcoming sessions on our website. Today, we're going to be talking about leadership, care for staff and self in the COVID era. Let me say just a few things about us. So first off, my name is Doug Fountain. I'm Executive Director of Christian Connections for International Health. And CCIH is an international network of about 115 organizations, plus about 15 affiliates, as well as several hundred individual members throughout the world. CCIH's mission is to promote health and wholeness from a Christian perspective, and we provide opportunities for capacity building, networking, sharing best practices, and for advocacy. This week, we are sponsored by World Relief. So each week we have some sponsors to highlight. We're sponsored this week by World Relief. For over 75 years, World Relief has been the hands and feet of Jesus for people affected by disaster, poverty, violence, and displacement. They work with over 6,000 churches and 95,000 volunteers to tackle our world's most significant challenges, and we thank them for their support. So here's how today is going to flow. Please feel free to type questions. If you're watching, you've already found your way to the YouTube channel. Feel free to type questions into the chat on the side of the video on YouTube. In order to post a question, you actually need to be signed into Google and have your own YouTube channel, even if you have no videos to share. They just require that. If that's a problem though, please just email your questions to webinar@ccih.org and we'll get them in that way. So again, either log into Google and post your questions there, or email them to webinar@ccih.org, and we will get the questions that way. This webinar is being recorded and will be posted on the CCIH YouTube channel in the 2020 CCIH conference playlist, and you will find links to the recordings on the CCIH website at www.ccih.org. Quick note also about these questions: we will watch the discussions for a week after this session today right now to see if there are questions we can answer or items to share with our panelists. So we will keep watching that, and if you have something that comes up, if you watch this at some later time, feel free still to contribute to the discussion or to the questions. Speaking of our panel, I'd like to introduce our panelists. Today we're going to be hearing from Priya John, Dr. Priya John, who is, well, I'll give the whole bios in a moment. Priya John, Ambassador Daniel Speckhard, and Margaret Schuler. So Dr. Priya John is the General Secretary of the Christian Medical Association of India, where she previously led its community health work. She earned her medical degree from the Christian Medical College in Vellore and degrees in community health and preventive medicines at St. John's National Academy of Health Sciences in Bangalore. So we're grateful for Priya participating. Priya, I know it's late in the evening for you, so thank you for joining us. Ambassador Daniel Speckhard is the President and CEO of Lutheran World Relief and IMA World Health, which are parts of the Chorus International family. He's a former US Ambassador to Greece and Belarus and has led the development of public-private partnerships with corporations, foundations, governments, and local communities. He was awarded the NATO Service Medal for his contribution to peace building in the Balkans. So Ambassador Speckhard, thank you for joining us. Margaret Schuler is the Senior Vice President of the International Programs Group with World Vision US. Schuler comes to this position from her role as Regional Vice President of World Vision in East Africa. She's worked in the field of relief and development for 25 years with organizations such as IRC, CARE, Save the Children, and of course now World Vision. She began her career as a Peace Corps volunteer in Tanzania, which is also where I started my international work. So Margaret, thank you for joining us. Thank you. I have a few questions that I'll just get going to start us off with, but again, a reminder to everybody who's viewing us to post your questions on YouTube or email them to webinar. We'll be able to pick them up and feed them in here. So I'll just get us started. You know, this year has spun very differently than any of us imagined. I made a comment the other day that I hoped with June 1st we would have 2020 Part B because Part A was not so great, but it's still very complex. Unlike many other crises in our lifetime, the COVID crisis affects everybody, though at different rates and severity. Today in the United States, we're also confronting racism and its effects. All our lives are touched in some way, and I hope we will learn and grow from all of this. So I'm looking forward to the discussion with each of you, frankly, in your positions of leadership. As we think about caring for the world, we also have to start by caring for ourselves and for our team. And this is why CCIH wanted to lead off with this, is to say, how do we stay strong? How do we begin by being strong at the core and with ourselves? So with that in mind, I'd love to give each of you a chance to tell us briefly about your role as a leader in your organization and of your team. What's changing for you right now? If you could just give us a little bit of an insight into that. Let me start with Priya. Would you start us off, please?
Thank you, Doug. Thank you for this wonderful opportunity. Really, it's a pleasure to be on a panel and share this space with very esteemed leaders, and thank you for that. Yes, leadership role, organization, and team. I think there's one more part, which is the self. I come from an organization which is a membership organization. It's the Christian Medical Association of India, which is a membership. I do lead a team of staff as the secretariat of this association. And of course, I look at myself in the mirror every day and I say, I need to look after myself too, as being this leader. So for my organization, I think there was a reminder, despite the changing environment, one thing is important is to focus on the core. Don't let go of the regular core activities of the organization. So as a membership organization, we have our constitutional requirements, we have our mandates, and we have our membership who we need to focus on. So that is important. Don't lose sight of that despite the changes. Make it happen in a new way. For the team, yes, there's been a lot of change when we've been working from home. There's been policies that have come in. There have been new changes in the way we function, both administratively, financially, as well as in our systems and our approaches to our workshops, etc. But the team approach is important in ensuring that they are motivated, that they are happy, that they are connected on a regular basis. So all the softwares that bring in this, make this possible has been initiated in our office, and that has been a big help. For myself, it's important for me to have some discipline, to get ready every morning, to slap on some lipstick if I have to do my exercise, which I'm failing miserably. But I have my family to push me a little bit. But taking care of self, having my own space, my quiet time is important, and that gives me the strength to plan for the day. Keep the weekend, the last Sunday night, just give that little space to think about the week ahead, and take the team with you with a smile, and ensure that you motivate them in everything that we do. And yeah, you can. I do allow myself some sugar and chocolate to look after myself. So, yeah, that's how a little bit of change, Doug.
I'm taking note of the suggestions. Thanks for that one. That's great. Thank you, Dr. Priya John. So let's go on to Margaret from World Vision. Can you maybe tell us a little bit about your role in your organization and of your team, and what's changing for you right now?
Great. Well, thank you so much, Doug. And hi, everyone. I'm so thankful to be here with all of you today. So I'm the Senior Vice President of International Programs for World Vision US. And that means I support about a $1 billion portfolio of public and private resources that go out around the world to support projects that span nearly 100 countries. And so I oversee, in doing that, I oversee a team of about 200 staff here in DC, in Washington, DC, and across the United States. And so this has been quite a change for all of us dealing with COVID. And really, I would say the biggest issue is that we're all working from home now. World Vision put in place a mandate that we were all work remote for about the last two months. And of course, what we've tried to do is keep centered by continuing the practices that we had before as a team, meeting regularly. I think in times like this, when there's crisis or uncertainty, what people really want is they want leaders to help lead them through this. And so my leadership team here in Washington has regular meetings with the teams across the country. And we're actually kind of finding out that Zoom isn't too bad in some ways. We're looking for opportunities among some of the challenges. And we found that actually Zoom can bring us together in some ways. And so I'm finding that interesting. And it's making many people on my team feel less isolated. And making them feel a part of our one team. Certainly in terms of myself and care for myself, I'm also working from home here in Northern Virginia, and home with my teenagers, and my daughter is home from college, and my son is a high school student doing online courses, which is challenging in itself. But you know, the good news and the positive aspect of that is that we're getting more family time together. So I guess I would just say that I'm looking for, and my team and leadership team are looking for the opportunities and trying to lead through the challenges during this time.
Wow, thank you. That's great. That's very helpful. Let's go on to Ambassador Speckhard. Daniel, please tell us about your role and your team and what's changing for you these days.
Thanks, Doug. And like the others, I want to thank you for allowing us to have this chance to share with so many of these folks on the webinar today. For me, I think some of the biggest things that have had a change for me and for our organization is the speed of decision making during a crisis like this. I think nonprofits in particular have a very robust, inclusive way of making decisions, where you want to make sure all voices are heard, where you want to get input from all different levels. And it creates a very consensual approach, which I think is really valuable in ordinary times. The challenge when you face a crisis is the speed of decision making has to increase significantly. And then, so for us, I think what has had to happen is I've had to be much more decisive than I was in earlier periods. And that doesn't necessarily come with, isn't comfortable to many of us in the nonprofit sector, but I think it's demanded by our organizations and our programs and the people that we want to serve, that we take actions much more quickly. And then the second piece is communications. Communications also has to speed up in the sense that even just this weekend, I can give a personal example. You know, I fell behind. As you know, the situation in the United States is very difficult with the challenges of social injustice and race, and it's playing out in cities across the country. And I got some messages from my staff saying, where are we? Where's the message? What are we doing as an organization? How are we speaking out? And of course, the leadership team had been meeting last week, but we were working on what we were going to say, and we were doing it too slow, and people wanted to hear from us. And I think that's the same thing in COVID. People want to hear often, much more often than you think. And they want to have much more insight into what you're doing now and what you're planning for the future. And that latter part has also been difficult for me. Usually you don't like to kind of get ahead of yourself in terms of future plans. But what I've seen because of this dynamic is people want to know what's going to happen when we have to go back to work. What are your demands of me going to be? How am I going to manage my current life and this future life together? So we've been working really hard at trying to do the best we can at kind of predicting what it is, and then trying to make people feel as safe as possible. So I guess the last thing I would mention, Doug, is because of that speed of decision making, I think we also have to delegate more. So at the one hand, as a leader, you have to be more decisive. On the other hand, you have to reduce the number of things you're making decisions on because it becomes more complex to make decisions in this environment where we can't all come together. And we need to move as many of the decisions as possible to the lowest level as possible, where people have the best information and connection, especially in international nonprofits where you're very far removed from the programs you're working at when you're sitting back in the headquarters in a remote place. So those would be my thoughts.
How much of this, I'm just looking, this is I'm just kind of picking up from all three of you. How much of this do you think is going to be permanent, and how much of this is changing? Daniel, as you're talking about speed, or Margaret, as you talk about more work on Zoom, and Priya, you outlined some approaches to your new ways of keeping people motivated and connected. How much of this is going to be different if, imagine COVID declines in a year?
Yeah, Doug, I would say that just for us, and we're already looking at, obviously, as Daniel pointed out, what life will look like when we re-enter kind of our offices, when we will do that, whether there's people that actually thrive in a work from home environment, you know, and so putting a lot more flexibility into our decision-making process about what is the best work life that an individual needs, and really tailoring that to individuals rather than assuming that everybody thrives in the same context, in the same environment.
Priya, how are people connecting? You know, I'm just curious, you know, when you were hinting at some of this with the issues and challenges that your staff are encountering, are people also relying on Zoom? Are they working at home, or are some of them in the offices?
We have 50 staff in our secretariat, and we all are connecting on Zoom every day. So we have a daily devotion every day from 9 to 9:30, and we end with the update of the last week or the last few days and for the coming few days. So everybody knows exactly what everybody else is doing. And now we are all connected through the Microsoft Teams. we have just found that to be exceptional in the way its reliability as well as its security issues. And we're able to post documents. And as Daniel was talking about decision making, it's much quicker when you have a quick chat, which everybody's looking at. You have one document where the changes are made. There's no version 1 and version 2, and it's much quicker and it's swift, and that makes us motivated. And many of my staff are already telling me we're working much harder than we used to, and that's a good thing to hear. There is a challenge, but actually the lockdown, I hope this doesn't change. You're talking about what's going to be permanent. I hope this motivated staff that we have now will not change, because it's so important for them to be on a regular schedule and get the deliverables done. And being a part of a membership organization, Doug, we have about 10,000 individual members and 273 institutions as members. So we have divided our country, you know how big our country is, and we have divided them into regions. So over the last 10 days, I've attended about 9 regional meetings, which is phenomenal, which is given me a really good idea of what's happening around our country with our members and their response to the whole COVID-19 pandemic. So that has been so rich in its knowledge levels and made us be better decision makers for what lies ahead. The way we interact with our government, because CMA, one role is advocacy. And unless we know the ground reality, we're not going to be able to say anything to the government. And all these meetings have been done by Zoom. And our IT person has really been on top of it and keeping the time and keeping the limit, the recording, the questions, the follow-up, everything. So that has been a big boon for us. The Microsoft Teams is how we connect as an office, and I think that's really good, and it's keeping us really motivated too. I'm excited as a leader.
It's a really interesting point about keeping up with what's happening in the field when you talk about the 10,000 members and the hundreds of institutions. And I know Margaret and Daniel, you both have the same thing with field offices everywhere and colossal portfolios. And so I just have to imagine technology has already been increasing as a part of how you keep up. But I think we must be doing that on steroids right now, because we've been forced all to rely on technology. People aren't getting on airplanes to go check on programs and keep up to date in the field. So
good point, Doug. I think one of the challenges that we worry about, I'm sure Margaret does as well, is the technology works pretty well here in certain places, maybe New Delhi and Washington and some others, but in some of the field programs where we're working, while in some places we are using mobile technology and other kinds of things, and we're going to continue to do that, the reality of some of the environments we're working in, the technology isn't as simple or easy. It's always been a challenge to ensure you have good bandwidth or support or even the resources to manage programs, training, extension services, support health services remotely. You can, and we're going to do it. I think that's probably one of the things when you're talking about what's going to be different in the future than now, is that's going to have a much more rapid development than we currently have, which I think is a really positive thing. If you think about us internationally, I think the amount of travel we'll be doing as executives will go down significantly. We'll realize, hey, we can get this done, and we can do it without losing all that time, energy, environmental carbon footprint, etc. But I think it's going to be even more impactful in the field when we think about how, especially in the health sector, you can really use technology to try to do support health services and other kinds of things for more remote areas. It costs money to set that up, but it's not at all impossible in today's world. So I'm kind of excited about how some of the possibilities for the future was. I guess the last thing I might mention on this, Doug, is I do think there'll be a legacy of this long in the future, just beyond some of these individual impacts. I do think it is kind of like a 9/11 moment here, where, you know, travel before 9/11 was one way, travel after was different. I think in terms of what the effect of this pandemic has had globally on the world, we're still even not coming to terms with how significant it's going to be in terms of changing some mentalities and structures and mindsets. And as folks who are working in the area of social justice, I am particularly worried about what it means for particular socioeconomic groups, because I think what will happen is more of this, what we have in the United States of a gig economy, of not hanging on to people or staff because you don't know what's going to happen, or you're responsible for them or their health or other kinds of things. And as you try to shrink and become more flexible as organizations, I fear for what that means. For us, for instance, we promised not to let go during this period, the people who don't really need to be working. We have drivers, we have security guards, we have receptionists, and we keep paying them. But you can't help but wonder across our entire sector who's going to think in the future, well, I'm just going to hire a firm to give me that service so that when I don't need it, it can go away. The problem there is that one socioeconomic group, I think, suffers the most in terms of the impact and the disruptions.
Wow, that's a really, really important insight. We're talking right now about how major shifts really in how we interact and approach our work and the changes that we'll see. That's really what we're on right now. Margaret, I wonder if you have any thoughts from World Vision's side about major shifts in how we interact, or Priya too.
Yeah, I mean, I think, so as I said earlier, I think the whole COVID crisis and situation it brings challenges and opportunities. And I think in terms, I'd like to focus a little bit on leadership, because I think it's how we as leaders lead that will impact how well we do as far as transitioning through this. I think we have to adapt better to technology or innovation in the digital space, both in terms of how we lead, but also in our field programs. But I think what's going to keep us grounded is to continue to ensure that the staff focus on our mission. And World Vision has a global strategy. So to continue to remind people and to have people guided by that mission, it's called Our Promise, and it goes through 2030. And it calls us to reach the most vulnerable children in the most fragile contexts around the world. If we keep people focused on the mission and their core values and the core of what we're about, I think that's going to help people also remain positive and encouraged throughout this time. I also look at it as an opportunity for people, individuals throughout the organization to build their leadership skills. And I think when we talk about leadership and we look at the different types of leadership skills, there's the hard skills, delivering results and ensuring strong teams, but there's also the softer skills, what we call, servant leadership skills. And I think this is a perfect opportunity for people to practice their empathy, listening, awareness, and ensure growth of their staff. This is a perfect opportunity for leaders to lead on that servant leadership piece and to grow their skills and to utilize those skills intentionally. As someone said earlier, I think, you have to communicate more. You have to be intentional about communicating more and often to your teams and be more visible and open. And I think communication in this new world is also gonna be key. I think there's a lot to be said about the role of gender in this, but maybe I'll hand it back to you, Doug, and we can dig into that in a minute.
Okay, we can dig into that in a minute. It's a good idea. It is interesting to think about how leadership is, on one hand, we're going back to reapply lessons and strategies that are hard earned and hard won over a lot of years of building experience. It's another thing to realize that maybe things have changed now, and the things that we value or elevate become more important in this time. So let's, Priya, I wonder if you have any thoughts about that, because the way that we lead our organizations, Daniel earlier talked about the speed of things, needing to be faster to get there, and then also needing to delegate more, and some of the points that Margaret raises about the opportunities to build core leadership skills. Is leadership itself changing in how you see things, or are we just having to get better at things that we already know?
Doug, I'm about 10 months into this leadership role, this specific one. So yes, it's been an overnight transition in some ways for me, because in the first few months, that is exactly till March 23rd, the pace was much slower. And I was getting my foot on the ground. I was getting hold of the systems. I was getting hold of what my core duties are as a leader of a membership organization. But overnight, the whole thing has switched gear. But it has been exciting simply because my staff got on board with me just as fast. They did take time to think it out, sort it out. So as the challenges came up, and exactly like what Margaret was talking about, every challenge becomes an opportunity. And the admin has stepped up. We've had admin processes in place where we're able to even punch in and punch out wherever we are. So we have our attendance marked. We have you want to apply for leave, you can do that through your phone. You want to make a statement about your attendance not being marked, that also you can do. There is a system in place. And then the whole finance system. I mean, we were able to do all our transactions without me running to office every time to get it signed. Everything was done and approved online. I think that was something that was, I'm really thankful to the team for stepping up to the challenge and so quickly. The challenge with the membership has been, and actually we are answerable to our board. And our board has been on, again, so quick. I called for a meeting at 4:30 and I sent out the invite at 3:15 in the afternoon. And everybody was there from the board. And there are 14 of them. 2 were unable to make it, but I had 12 people from my board at that meeting. And I thought that commitment was so encouraging for us as staff. And they knew exactly what we were all up to. We gave them an update. And now for the last 2 weeks, we've been talking to our regions, and we're slowly going to start talking to each of our CEOs from the member institutions, of which we have 273. So that is going to be another exciting phase, because we're bringing in our network partners who will help us with advocacy, who are going to help us with trainings, and who are going to help us with just the whole spiritual rejuvenation and strengthening. So that's going to happen. And as CMEI, to help and protect our partners, I think the first priority was to get the personal protective equipment to all of them. So in the last week of March itself, we sent out a survey, we got their requirements, and we got on board with a supplier who could do it to these remote areas. And we were able to supply this PPE to about 115 of our institutions, which I really thank God for, because that was an achievement. And the team has really been good, because they were able to get the orders done, the amount done, and the payments done. And all in good time, with constant talking with the members. So that connect was there.
I want to pick up on one thing you mentioned a moment ago. You said spiritual rejuvenation, and I know that's going to be of interest to a lot of our members. What do you mean by that, and what's changing in that right now during this time?
So we have mission hospitals. We are church affiliated, and as CMEI, we are the health arm of the National Council of Churches in India. So our mandate is to work with the church. So many of these 273 organizations are owned and affiliated with the church. Now, as you know, there will be difficulty in the economics and the revenue streams during this period of lockdown. There has been forced salary cuts simply because there was no patients able to come to the hospital.
Yeah.
That led to staff being demotivated, and they felt they were not being looked after enough. But that was a few of them. But the predominant story that we're hearing throughout the regions is all the private hospitals had shut down, and only the government and our mission hospitals were open. Even though we are getting the COVID wave just now, throughout these 2 months, they have been busy preparing, making their own PPE, serving the community, taking food out to them, praying together, sharing together, strengthening each other. And the churches have helped a lot in that too. You know, they've helped in cooking food for the doctors sometimes, or serving the community at times, and their own congregation at times. So when we talk about spiritual rejuvenation, is when you just keep that, like Margaret said, the mission. What is our mission? It is for the poor. In our country, the poor are defined. We have a definition for poor. And when the focus is to ensure that they are served and they are benefited with all the struggles that we're seeing in with the lockdown, especially with the migrant laborers, we ensure that they are being served, whether it's through an advocacy route, or whether it's through just simple going out to the community and helping them, or whether it's using technology for something like telemedicine. Yes, connectivity might be a problem, but that is something that we're really focusing on. And the Catholic Health Association of India has now invited us for a webinar on the telemedicine. One of our key institutions have started to.
You must have one eye on one of the questions that had just come in about, do we need better web connectivity for the field, and some manuals on how the technology can be made available in remote areas, phone hotspots, that type of thing. So it was interesting you brought up technology.
Doug, can I jump in for a minute on the question of spirituality?
Daniel, please go for it.
I just thought that was a great question and comment. And as a faith-based organization, you can get so busy in your work that you kind of just take the faith part as a given, as to the motivation for why we're doing what we're doing. But what I found for our organization during this time of COVID was that we realized how important it was for our staff and ourselves during this period. So we started a daily pause. We call it a little devotion that happens between 12 and 12:15 every day, completely voluntary, a non-denominational and non-faith, in the sense of Muslims, Christians, Jews, Buddhists, Hindus are all welcome. And the leaders of this group just help us come together to have a small meditation and devotion on an issue of the day, and then join in corporate prayer, and then open it up for comments and discussion to see how people are feeling. And I was amazed. Normally during a normal time, you'd get 10 people out of, we have 800 people in our organization. The first time we did that, we were getting, 70 people, and that's here in this time zone. And it's gone on now for 6 weeks, and we're still getting that kind of attendance. And it just reminds you that you can take your people for granted in these times. And I think we forget, especially as leaders sometimes. We have been, tested through our periods of training and so forth. And to become a leader, you really have to be a bit resilient. But not everybody in our organization is as resilient as we are. And I think it's really important to remember that. And really important to remember how diverse we are as a group, and all the other challenges besides COVID that some of our work and family are going through in our work family. So I just wanted to re-emphasize the point you were trying to raise, Doug, about how important faith can be for the people we serve, but also for our own communities.
Well, that's the difference that I hope that faith-based organizations have front and foremost, because otherwise there's a lot of secular groups that are doing fantastic work. What's different about us as faith-based organizations is we have that first. So keeping that important thing in mind. I want to pick up on something that, Margaret, you mentioned something about gender roles in leadership. As we're talking about spiritual rejuvenation and the role of faith leaders and leadership practices and all of that, but let's shift for a moment and talk about gender roles. I think you have some thoughts on that.
Yeah, thanks, Doug. One thing I would say, just that is an overarching comment, is that we do not want to take steps back during COVID or during a crisis in terms of diversity and inclusion. We put a lot of effort as global organizations in strengthening diversity and inclusion and the gender, working on gender issues. So sometimes in a crisis, we can lose our focus, but again, keeping focus and ensuring that we don't take steps back. You know, the number one thing I think that people are dealing with around the globe is the uncertainty about when things will return to normal. So, you know, we need to think about policies, and a lot of this is built on the fact that people are in a situation. If I take my own staff here in the U.S., people are working from home. They're dealing with trying to balance work and leadership and family life all in one place. And I know that's challenging for both for women who really take on a more significant burden for household activities and childcare, but also for men as well. And how do you balance that within a household? And I know that's a challenge not only here in the US, but for people around the world. So we want to get we want to ensure as organizations that lead staff that we continue to strengthen our remote work and flexible schedule policies, and see how we can do that creatively. And I know that's something World Vision is talking about a lot. But again, it's an opportunity. We want to make sure that we have women represented in the response activities, in recovery activities, and as we move forward. And so again, just building on the expertise that many of our organizations have already with gender programming, we just want to strengthen that and not forget that and keep that front and center. And it's a diversity and inclusion kind of policies and also practices within our operations.
Sounds like the two things. One is keeping gender and diversity initiatives moving forward. The World Vision is engaging in, but also taking care of the people who are on staff or who are associated with the organization for executing the work. I can imagine that's very complex in incredibly diverse cultural contexts around the world. How do you do that? How because different roles or assumptions are going to be very different from one country, one context to another.
You know, I think one of the ways that we deal with that is ensuring kind of a appropriate orientation of our leaders and our managers across the globe. We have leaders who we expect leaders to uphold certain standards, and one of them is to ensure diversity and inclusion is a key element of what they focus on, keeping it front and center for everyone who leads in World Vision across the globe, and then provide them with ways in which they can do that better. That will start to hold people accountable for that, even through a crisis and into the recovery phase of COVID.
Very interesting. I'm going to move on to something else, but Priya, I don't know if you had anything you wanted to add to that really quick. Otherwise, I'll move on. Okay. There was a question that came a moment ago from David Scheinman. With the pandemic, what is the biggest challenge you have faced in fulfilling your mission? And I know one of the questions that we had thought about in leading up to this is, how do you stay true to your mission during times of crisis? Or how do you keep your focus on the holistic needs of the people you're serving during times of difficulty? How do you keep your focus on your mission during a time of crisis? I'm curious what you all think about that.
Doug, I would just jump in and say for us, it's actually, I think, helped in the sense that people are really a bit at a loss to be part of this global pandemic, trying to work from home and everything else. And so what I've seen is a doubling down of our team in terms of their interest and focus on how can we get what we need to do done. And it actually is fulfilling on a personal and spiritual level for them to stay focused on mission. I think the biggest challenge from that question for fulfilling our mission is the global nature of what's happening here. You know, we're all used to dealing with crises in specific countries, but the resources and support that can go into addressing that crisis in a country or region are still functioning well. But here we're dealing with a global crisis where everything from supply chains to the logistics to transportation to the normal air routes are all breaking down all at the same time, while in your own country you are facing restrictions as well. And that combination of having this all happen at once is what I think is really unique for all of us during this particular period. It's not just one country or one region suffering while the rest can figure out how to work and the global systems come together. So I think what's called for leaders and managers in this process is a real requirement for innovation. We talked about that a little earlier in terms of the speed of decision making. But you have to think outside the box, and you have to think outside the box quickly, and you have to take risks that you normally don't take. You have to spend money that you don't yet have, and you have to make those decisions at the very front, like Priya was saying about PPE. We didn't have the money, but we knew we're going to need PPE, and we knew we needed it now. So we had to take $1 million that we didn't have and go out there and start buying and doing it, and trust. Good thing we're a faith-based organization. Trust that this was going to work out. That's uncomfortable for my nonprofit, and I suspect it's for a lot of our listeners as well. This is not a space that we're normally used to. This is kind of business space where you take these big risks and you get out there and you put all of this on the line. We're much more comfortable in the thoughtful planning, careful, incremental approach. And what this pandemic requires is a completely different rethink about how you're willing to tolerate risk and how you're going to make decisions, and where those decisions are going to be made and the speed at which they're going to be made.
The technology field has a great phrase for software development, which is fail fast. The idea is there will be failures, there will be mistakes, there will be things that don't work. Find them fast, get there so that you can learn from it and get it back right. Fail fast. I love that. I hate that.
And if you'll forgive me, Doug, for just jumping in, that is a good point, although I hope we don't fail too often. Let's just fail fast in a few places. But the question on the chat also talked about, the challenges that we're going to face with funding cuts and other kinds of things while your needs are growing in the world. And that's really true. The one thing I would say there as well, though, is we have found that, during these periods, people are willing to give. And in fact, you can see raises in the amount of funds that you can raise. And it's an amazing thing, but I think people open their hearts, they see this need, and even in spite of their own challenges, we see people at all socioeconomic statuses giving us support and donations during this. That being said, you have to be creative in how you raise those funds as well. If you use the same system that you were always using before, you're going to have challenges. You have to understand the dynamic that is happening around you, figure out how to carefully invest in additional fundraising efforts. But I don't think it's a foregone conclusion that nonprofits have to just accept what's happening to them as they see less coming in, and that there are opportunities to be creative, because people out there are spiritually called actually to be serving through giving and donating during these periods.
Well, I'll go back to Priya here, because a few moments ago you were talking about the work with the church in support of healthcare, and you had brought that up on one of the CCIH forum calls a few weeks ago, and it was really impactful for the people on the call to hear about because we can locally produce some PPEs, that getting the churches involved in that, actually having the churches do it as an income generating activity, and also to then support the healthcare was something that I had not heard from many other places. So I'm just picking up on this idea that, again, let's go back to how do we stay true to our mission. Speed and innovation are things, and not being resistant to taking on risks. I appreciate those thoughts from Daniel. Priya, any thoughts that you have about that? How do you stay true to your mission?
I think this reminds me of a Bible verse which I've been quoting a lot actually for the past few months. This is from Acts chapter 5 and verse 33 onwards, where where Gamaliel brings Paul and another apostle to before the court, and saying, what are they doing? What they're doing is wrong. And then he says, just back away from them, because if this work is of God, you cannot overthrow it. But if it is of man, it will die on its own. So don't worry about punishing them. So that is where I think, as Margaret and as Daniel have both said, and as you have reminded us, Doug, staying true to our mission. What is the mission? Keep those words clear in our head, for not just for me as a leader, but for my staff as well as for the membership. Because throughout this time, we have seen that they are clear on their mission. Despite the ups and downs of motivation levels, they are clear on the mission that they have, serving the poor, of being there to serve no matter the cost. And that is something that, and if we are doing the work of God, there is nothing that can stop us. And the funds will come. We are spending, even today I signed off on something which I didn't have the money for, but God will provide it if we're doing what is right by Him. And many of the prayers, I know CCIH has regular prayers, ICMDA has, we have our regular devotions every morning. Everything helps. It might be one word from a song, it might be a scripture, it might be a sharing from somebody. Or even just somebody's positivity on screen makes a big difference for the day. So the church helping us and keeping us motivated, they've also been organizing a lot of prayers and calling us and encouraging us. I think that has been also very personally, very edifying. So keeping the connect and communication despite what's going on has been a big strength for us, and keeping our mission as central. And that's why our mission hospitals haven't closed. They're still running. They're working day and night. So that's the encouragement.
The historic Christian, in the historic Christian faith, the Christian church has been there through the worst of global plagues and epidemics. So I would expect the mission hospitals, hopefully they would be able to stay open. Margaret, any thoughts?
Doug, can I just jump on that and then I'll turn it over to Margaret? But this fits with one of the questions in our chat about how we can use religious leaders and key stakeholders in this effort. And for what we're doing, we're very much focusing on the Christian health associations in Africa as key leaders and structures, particularly in the health area. During this process is how we think through how services can continue to be provided through the people who are closest to the situation and through the faith-based organizations, which have oftentimes the most credibility with communities during health crises. And so I just think this is really a powerful time that actually may accelerate something that USAID and others have been pushing, which is this notion of doing more locally and less internationally. So I see this as a potential also key catalyst and motivating point on the positive side for this. Excuse me for jumping in, Margaret.
No, I love that, and thank you. You mentioned the Christian health associations. That question even came from Simon, who's with one of those. So please. So Margaret, we were talking about staying true to mission, but I wonder if you have anything you'd like to add to that.
Yeah, this has been such an interesting crisis for World Vision, because we feel that we had to do something that World Vision has never done in its history, which is declare a global health emergency response. I mean, it's regional or targeting a certain country or two, but this is a global response. So we're also responding domestically here in the US. And what's exciting and interesting is that we see a huge amount of support from people, just similar to what Daniel said, for our mission internationally. We're responding here in the US. People are feeling the pain of COVID here, but also have empathy for others then around the world. And so we're actually feeling, World Vision folks say oftentimes this is what we do best, is we go in and we respond. And I think what's helped us do that is having those boots on the ground already and really being able to respond quickly and rapidly to the situation and utilize lessons learned from some of our ongoing work, like our WASH work, which you can easily see being some of the messages that we've been promoting through faith leaders and others are very similar for COVID. So utilizing those skills that we already have to respond rapidly has been key. And so we feel we're able to continue to focus on our mission and that we can mobilize support, even though it might be in a different way, as Daniel said, than we had done previously.
We're heading down to our last 5 minutes, and there are some exciting questions that are coming in. Naturally, we won't be able to get to all of them during the time that we've got here, but as I started off with, part of CCIH's approach on these is we will monitor the questions and try to encourage discussion with our panelists and see what things we can also help to clarify or to answer as we go on. But there is one question that sort of sets up the last few minutes of discussion for us from Dan O'Neill. Does the crisis enhance our faith and connection because of separation, limitations, and uncertainties? Does this crisis enhance our faith and connection because of separation, limitations, and uncertainties? That's an interesting question, and it pairs with how we were hoping to close out with, which was a question about how does your faith sustain you? So I'll ask generally, does this crisis enhance our faith? And then specifically for you, how does your faith sustain you in your work?
Doug, maybe I could just start by saying I think it can, but for me, faith and is about relationships. Really, it's our relationship with God and God's desire for our relationship with each others. So it depends on how we react in this crisis. And that does worry me sometimes with Zoom, that we kind of feel more separate, even though we see each other on a screen. You don't catch those little comments or words or whatever else when you see one of your colleagues in trouble or a difficult time, and it can lead to isolation. At the same time, that isolation can drive us to look to God for more sustenance. So I think the jury's out on this, but I hope that the focus will be on relationships for us as leaders. If we want our faith to grow and we want our others' faith to grow, it's about how do you take this time to make sure you're not missing everybody in your organization, what they're feeling and what's going on in their lives. For me personally, I remember my favorite verse is Isaiah 58:10. If you pour yourself out for the hungry and satisfy the desires of the afflicted, then your light shall rise in the darkness and your gloom shall be as noonday. What I love about that is it tells us, Isaiah says, our gloom, the ones who are helping others, it's our gloom that'll be as noonday. And in this global crisis, I think remembering that it's not a giver and a givee, it's about relationships again, and that we all benefit spiritually when we come together to reinforce and support each other in service.
Wow, yeah, I really appreciate that. Priya?
I think I second what Daniel said, because again, in the book of 1 Peter, it talks about how all our talents, all our skills, whatever strength that we might have, if it does not translate into helping and showing love to your brother, it really doesn't make sense. So if we as leaders can use our strengths to ensure that everybody that we serve, and the taking off from what Margaret said about servant leadership, ensuring that we serve and ensure that people that we are coming into contact with are benefited, and they see the love, they see the care, they see the compassion. I think that was one encouraging thing. And also from Psalm 67 verse 2, which talks about the saving health. That's what the King James Version says. It says the saving health from the Lord which will sweep over. And that is something that I'm going to be holding on to during this pandemic. And ensuring that whatever strengths and talents He has given us or given me, it will be used to help somebody else. Whether it's my own staff, whether it's my family who's been my strength, or if it's the membership that we serve. And ensure that He gets all the glory in that process.
Wow, thank you. Margaret?
Yeah, I would just say, people are excited and energized by our mission to help the most vulnerable, but they do become weary. And so one thing that we have to remember is God is our refuge and strength, as is stated in Psalms 46, 1-3. And so we try to remind our staff and pray for our work, but remind everyone that God is with us. And that's an encouragement as we go through this time and as we do our work in very difficult contexts and places around the world, and as we lead and learn to lead in new ways. that God is with us. He's our refuge and our strength.
That there was another question that had come in a moment ago about, as spiritual leaders, how do we all answer questions related to balancing having patience with God's timing on resolution of the pandemic and the urgency of those most suffering every day. And there was another question about what's causing our priorities to change. That's a whole separate webinar to get into all of that. Any final sentence or thought, and then I'll close this out in prayer after that. Any final thought, particularly about balancing, having patience with God during these difficult times, or word of encouragement perhaps for your staff or for others? Any final thoughts?
Doug, my final thought would be, think bold, all of you who are listening to this, in terms of what you're doing and what you're trying to do in this. That's what, for me, being faith-based means. If you don't have a God-sized vision for how you're going to respond to this, then you're just another secular organization. We can think way outside the box, and I want to encourage everybody to do that.
Wow, thank you. Thank you. Margaret, any last word?
Yeah, just thanks so much, Doug. I mean, I would just encourage people to really look for kind of what we like to think of as work-life harmony. Make sure you balance your work and the focus and the all the challenges that leaders are going through right now, and look for time for centering yourself as well. And I think that balance will help guide you through this entire crisis, and we'll all end up at a better place on the other side.
Wonderful. Priya, at the start you talked about reflecting on Sunday night before the start of your next week, and making sure you're working in exercise and also chocolate. And all three of those are things that I work on actively in my life. So please, any final thoughts that you've got for us?
God's timing is perfect. And I think it's a good opportunity for us at this time to draw strength from Him, pass on that strength to somebody who needs it, and to ensure that we know who needs it, keep our eyes open and our hearts open and not fixed on the screen, and learn to smile through the mask so people know that you're smiling, and ensure that you connect. God's timing is perfect.
God's timing is perfect, and smile through the mask are words that I will also hold on to. Thank you for that. Thank you to each of you for participating in this, the first of our CCIH virtual online conference. This has been an incredible hour with you all, and I'm touched and blessed in many ways. Let me pray for you and for each of the people that are participating with us online. So let's pray for a moment. Lord, we thank you for this time. We thank you for technology that has worked and brought us together. Thank you for the Spirit that you provide for us, and the fellowship that we've enjoyed as this group here. Thank you for Daniel, Margaret, and Priya for the work that they do for their respective organizations. Thank you for all of the people that are participating with us remotely. Bless each and every one of them and the work that they have to do for the sake of your name. In Jesus' name we pray. Amen. Everybody, thank you so much, and thank you to all of our people that have been on with us so far. Again, if you're joining us after this session and watching, we still have a week. We'll watch your comments and questions and see if we can get things answered for you, or get some feedback. So thank you, everybody. So